And it is now my privilege to introduce our first speaker, Gary Fletcher, St. Luke's Senior Vice President and Chief Operating Officer, to get us started and talk about system alignment. Gary has been an incredible friend and colleague. I attribute and owe much of my success to Gary. He's been a terrific partner and colleague during these past 4.5 years. He's the heart and soul of St. Luke's. On April 1, Gary is going to transition to helping us with our physician network. He's been serving in the role of Chief Operating Officer for the system. On April 1st, Chris Roth will become our new System Chief Operating Officer in anticipation of Gary's retirement at the end of this year. It's unthinkable to think of us without Gary. I still haven't really admitted it or adjusted to it. I probably won't until the very last day of the year. But I got to tell you that Gary has done so much to make our organization successful. And one of those areas that he has worked on is a really crucial step for preparing us for the future, and that is the restructuring and realignment of our governance structure. So Gary, come and talk about that.
Am I turned on here? Can you hear me? Well, I'm glad we got that out of the way, David. We don't need to talk about that again today. I do believe this work is a team sport, and I've always felt that way. And I think, I look around the room here, and the discussion I'm going to have here in just a few minutes is one that we've talked to everybody in this room about, and you've all heard what I'm going to say, and you could stand up here and give the talk. So I'll go through this rather quickly, but thank you, David, for the introduction. And I just believe that the power of the people in this room, the boards and the leadership we have, can get us to wherever we need to go in this organization around transforming healthcare and doing the best job for the people we take care of throughout the region. It's just amazing to me that we've got so much energy, so much enthusiasm, so much direction around what we're trying to do. And the people in this room are the ones that are going to lead us down the path of population management, taking better care of the people that we take care of, using our resources more efficiently in what we're trying to do. So what we've been trying to do here the past year or so is to align the system through restructured governance and operating models, and we've accomplished a lot, got a lot of work done, but there's still work to be done. As I saw my friend and former boss, Ed Dahlberg, here in the room, I think he's still here. Ed, are you here? It reminded me of several years ago when we started to put the system together. And at that time, we talked about the importance of having a system that could manage the care of people across the region. And that was several years ago. And that's what was behind formation of the system. So where are we at now? We're talking about the same thing, only we're getting into the body of work that's going to be necessary to really get this work done. So if you look back at where we've been, starting way back at the beginning of St. Luke's, and I won't go through each of these, but you get into the mid-'60s, and we had Meridian Children's Hospital, Wood River opened, and then we really began to pick up steam in the middle 2000s with the addition of Magic Valley Regional Medical Center, where we really became a system. And since then, it's been a fast ride, hasn't it? Hold on to your seat. St. Luke's Clinic was formed. McCall joined the system. We developed innovative payer practices, and in 2013 began operations as an accountable care organization. And I'm proud to be here and talk with you about what we've accomplished this last year relative to governance. This is one of my favorite exhibits, charts, if you will. And I think if the truth were known, one of our IT people, our IT leader, Dr. Chasen, came up with this. Can you imagine an IT folk coming up with a diagram like this? But it speaks to how well we in general know what we're trying to do. So this is a continuum of care, and I think clearly represents what we've been trying to do with the governance and operational restructure that we have been working on, and Dr. Pate spoke to earlier. But if you think about this, to my right, and I think, to my right and your left, begins the care continuum with this whole area of health, maintaining health, health management, population management, that we really haven't been involved in to a large extent. Okay, and then toward the middle of this, you have the traditional work that we've done, diagnostics and treatment, and then post-acute care, which, by the way, represents 20 to 30% of our overall costs. A lot. And so if you look at this care continuum, then it's really what we're trying to do and take in terms of managing the health of a population of people that really justifies what we've tried to do with our governance structure. This work to my right and your left is work we haven't done. And what are we doing? We're repurposing the community boards so they'll focus their attention on what's really needed in their communities relative to access. And, I talked Tuesday morning at the McCall board meeting, we talked the uninsured rate in Valley County in that area is 40%. 40%. People aren't getting into the system. We got to figure out a way to get them into the system. So there's 2 or 3 key reasons why we're doing this. One is to set ourselves up to manage the health of people. People that aren't sick, keep them well, and people that are getting sick, get them access into the system so we can take care of them. The traditional focus, and then post-acute care. The second thing we're trying to do is determine how we can most effectively utilize the resources that we have around taking care of what? Our common patients. So out of that comes this regional structure where we're bringing people together regionally to manage the care of common patients. Okay, and that's the work that we're going to be doing. And then what this structure does, it brings together who? Board members, physicians, and leaders in a way that we figure out how to best manage the resources that we have to take care of our common patients. So areas of alignment are our governance structure that we've been working mostly on. Talk about here in a minute. Alignment of the operating structure. All this is happening pretty fast. We just finished meeting with all of the entity boards, approving the new bylaws. The system board will approve the bylaws and the structure at its March board meeting. And we're already starting as leaders to figure out how we can support this governance structure in a meaningful way going forward to do population health, to manage our resources as best we possibly can. So alignment of the governance structure has been the focus. Now we're coming along with realigning the operating structure. We just met for 2 hours this morning. We take advantage of these meetings when we get together. We met for 2 hours this morning, our leadership group, starting to figure out how we're going to best organize ourselves to support the regional boards, the community boards, the regional committees going forward. So there'll be a lot of work that will continue around that, along with alignment of the advisory groups and councils. So here's the we say approved governance structure. I guess we got a month to go. But fundamentally, this has been approved by the entity boards and will be presented to the system board on the 13th of March. And this is what we're going to be going with. So we're going to end up with 3 fiduciary boards, the system board, the East and West regional boards. Each of those regions will then have committees that are indicated. We'll have our community boards that will be the tip of the spear relative to population management, determining what the needs are in the communities, deciding what the delivery model needs to be in those communities, and then bringing all that together under the regional boards in a way that we take the most efficient advantage of the resources we have in delivering the care, providing the access that we need throughout the system. Now, there's still more work to do, but we're making progress. It's not perfect, but you got to start. You know, one of my favorite sayings, what is it? You got to start before you finish. This is a heck of a start. And we've all worked together on this throughout the system. Leaders, board members, physicians, we work together to get this started. Now we've got to commit to it. We've got to make it work. And there are other parts of our structure and our system that we need to work on. Certainly, we need to figure out how we most effectively integrate philanthropy in all we're doing. We need to be sure that all parts of our physician structures and leaders are involved in what we're doing, and we need to figure out how we integrate the network too. So there's a lot of work yet to be done, but we're started down this path. We've got a beginning, we've got a foundation, and I know we can do it. You know, when you think about the whole area of integration, and you know, this is something that we've talked about too, all of us, as we've worked on this. You know, we're going to have vertical alignment through system, regional, community boards. We're going to have common goals that we're going to work on. And then we're going to have horizontally common policies, procedures, and practices to do that work. So we think about this from the standpoint of alignment, and then the horizontal, how we're going to do the work, common practices coming together to produce the integrated system that we need to have for the future. And that's going to be the body of work that we're going to be working on throughout the system. Another way to think about it is aligning ourselves around common patients and doing consistent work throughout the system. So what's next? As I indicated, we started to get together as a leadership group to talk about how we operationalize the governance structure, support it. And so all of you need to be ready for us to be talking to you about this. Because what do we need to do? In March, April, May, we need to ramp down the current structure and ramp up the new structure. And there's going to be some overlap that's going to occur, and there's going to be lots of meetings, lots of new people on committees, although there'll be folks that are used to being on our committees and boards that will be familiar with what we're doing. So it's not going to be a new drill, but we're going to be ramping down and ramping up the new structure. So it'll be exciting. It's going to be a lot of work, but it really provides us with the foundation going forward for the future. I can't tell you how proud I am of all of you for the good work that you've done on this. You know, we started over a year ago and it was a little clunky. We made a lot of changes, but we came together and voted together to put this governance structure in place that will be followed with an operating structure. So this isn't leaders. This is board members, physicians, supported by leaders that have done this work. So you have ownership in it, and we together, collectively, need to work to make it successful going forward. I want to thank all of you for that hard work, all the meetings that we've had, and the confidence and trust that you've placed in each other to move this forward. I want to thank Courtney Kirshner. I want to thank Barbara and the governance committee that have worked hard on this, Christine Newhoff and Taylor Pitts and many others. Dr. Pate for getting us going. I mean, this has been a team effort, a team sport, and you know what? It shows us what we can do. It shows us what we can do if we come together around a common vision. We can get anything done that we want to get done. Thank you very much.